Welcome. You're watching this DVD or video because you or someone you love is suffering from a thyroid condition. And more than likely, you are very frustrated because you're not getting any answers. This video will change the way you look at your thyroid condition. Please watch it all the way through. I am here to tell you that there is new hope. If you are tired of dealing with this problem and you're worried about it getting worse, learn how your thyroid condition can be helped. This video may change your life. Today we're going to explain about what we do and how we're different than any other doctor you've been to. We're going to explain the thyroid gland and how it works so you understand your condition. If you're interested in what you hear today, you can invite yourself to a one-on-one consultation with one of our doctors. At this visit, we'll sit down with you and we'll go through your case history, your past medical history, your family history, and all your signs and symptoms, and any previous lab work if that's available. And then we'll determine if you're a good fit for the program and if I'll accept you as a patient. Now I'm here to tell you that no stone will be left unturned to determine the exact underlying cause of your thyroid condition. And most of you are going to be shocked at what you hear. Let me introduce myself. I am Dr. Keith Unger. I'm a chiropractic physician. I am board eligible in neurology. And I'm also a certified gluten practitioner. I graduated in 1983 and I've been practicing in Ohio since 1985. I am also author of the book, Your Thyroid Chemistry Doesn't Lie. The reason I titled it, Your Thyroid Chemistry Doesn't Lie, because what you're going to learn here today is that your thyroid chemistry is different than the next person's thyroid problem, the next person's thyroid chemistry, the other person's thyroid chemistry. You're going to find out that everybody is different. Now, I've lectured to medical doctors, chiropractors, holistic doctors, naturopathic doctors. First and foremost, the first question everybody asks me is, what's a chiropractor doing treating a thyroid problem? What does he know about thyroid? He went to school to learn how to adjust spines. Well, most people don't realize the education we have in chiropractic school. So I'm going to show you a chart that talks a little bit about the amount of hours here. Now, if we take a look here, we can see that these are the minimum amount of hours. Medical class hours, 508 anatomy, 520 chiropractic. Physiology, 326 to 420. Pathology, 335 to 271. Chemistry, 325 to 300. Bacteriology, 130 to 114. Diagnosis, 374 to 370. You can see that we are taught to do differential diagnoses. Now, if somebody comes in with low back pain, we have to rule out, is it a kidney problem? Is it a low back lumbar stenosis? Is it a disc injury? Is it a pinched nerve? Is there some type of pathology going on in the lower back? Neurology, 112. We get 320 in chiropractic school. I have additional 300 hours in neurology and am board eligible in neurology. X-ray 148 to 217, psychiatry 144 to 65. OBGYN 198 to 65. We had to do the gynecological exams in our internship before we could graduate. Orthopedics 156 to 225. If we take a look, our basic science courses about 2756 to 2887. Now, when doctors branch out into pharmacology and maybe general surgery, chiropractors are going to branch out into chiropractic and nutrition. By the time we get done, about 4248 and about 4485. So the whole purpose of this chart is to basically show you that we have a pretty depth in education. Now, let's take a look at some of the textbooks that we use. If we take a look here, you can see this is a textbook of medical physiology. This explains basically physiology, that word. That's the study of the cell, how things work at a cellular level. Okay? Same book they use in medical school, same one we used in chiropractic school. This is the pathological basis of diseases. Basically, pathology is basically the study of disease or how the body breaks down. So you can see that we basically take the same basic science background courses, use the same books, and we branch out into whatever specialty we may want to branch out into. Now, I also want to share with you my own personal health problem that led me down this road to treating thyroid patients, diabetes, chronic conditions, autoimmune disease, and I'll share my personal story as we go through this video. Okay, that's enough about me. Let's talk about you and your thyroid. Most of you went to your medical doctor for an office visit, maybe a routine annual exam, maybe it was a routine office visit, because you weren't feeling like your old self. Your energy levels were low, your weight kept going up despite the fact you were exercising every day and eating less, your sleep was not as good as it used to be. So what did your doctor do? He decided to run a TSH test on you. And that TSH, that stands for thyroid stimulating hormone. Now the TSH tells your thyroid gland to produce more thyroid hormones. And we'll talk about that in a lot more detail a little bit later. So the doctor runs a TSH test on you and one of two things happen. They either say it's normal or they say, oh, you have hypothyroidism. So if you have hypothyroidism, what did they do? They got their pen out and their prescription pad, they wrote you a prescription for Thyroid or levothyroxine, and now there's other meds out there, but these are the most commonly prescribed. Then the doctor tells you to return in 3 or 6 months. You go back, they rerun the TSH blood test, and they tell you what? Your TSH is normal and your thyroid's fixed, but you don't feel better. You keep going back to your doctor and you're telling them you're not feeling better. For some of you, you have difficulty losing weight. Some of you, you have no energy, or you're fatigued or sluggish. For some of you, have difficulty falling asleep. Now, others have difficulty staying asleep. You go to bed in a couple hours, you wake up, and what happens? You can't go back to sleep. For some of you, it may be 20 minutes. For some of you, it could be an hour. For some of you, it could be 2 hours. And then this happens several times through the night, and you get up in the morning, and what happens? You're not well rested. So you go back, you keep telling your doctor all this, but nothing is getting better. You ask, why do I have all the symptoms of hypothyroidism? The answer is usually this: I don't know, but it's not your thyroid because your TSH is in the normal range. So they usually tell you that you need to exercise more. Well, that's kind of hard to do if you have no energy. You have a hard enough time changing a channel on your remote control clicker at home, and they want you to go out and exercise, and you can barely function to get through the day. Okay? Folks, this is not uncommon, and I'm here to tell you it's not all in your head. There's about 20 million Americans that are affected by thyroid disorder. That's 1 in 13 people. More than half of those people are unaware they have a thyroid problem because it frequently goes undiagnosed until it gets severe. Now, according to the National Women's Health Information Center, 1 in 8 women will experience a thyroid disorder during their lifetime. The reason why this fact may surprise you is because you probably never heard it explained to you. That's because most doctors are only vaguely familiar with thyroid disorders. Are you tired of running from doctor to doctor only to find out they say nothing is wrong, or let's give another prescription? Here's this drug, that didn't work, try this one. Are you tired of taking drugs that don't fix the problem? Do you continue to struggle with chronic thyroid symptoms day in and day out? Then keep listening. I'm going to tell you how to fix your problems. If you're tired of dealing with this problem, you're worried about getting worse, you need to learn how your thyroid condition can be helped. So first of all, let's talk a little bit about the symptoms of hypothyroidism. Number 1, are you fatigued, tired, or sluggish? Do you have cold feet and hands? Do you require excessive amount of sleep to function? Do you gain weight easily, even though you're exercising and cutting down calories? Do you have difficulty or infrequent bowel movements? Are you depressed? Do you suffer from depression or maybe anxiety? Do you suffer from lack of motivation, where you used to do your checklist and now you write a checklist, you look at it and you set it down and say, I'm not going to do that today? Do you suffer from morning headaches that wear off as the day progresses? Do you suffer from thinning of the hair or maybe excessive hair falling out? Do you suffer from dry skin, or maybe your scalp is dry? Do you have mental sluggishness? That's a list of some of the symptoms for hypothyroidism. Now let's talk about some of the symptoms for hyperthyroidism. That's when your thyroid gland is working too fast. You might have heart palpitations. You might feel like you have this inward trembling. You might have even an increased pulse rate, even when you're resting. You might have nervousness, be a little bit emotional. You might suffer from insomnia. You might have night sweats. Some people with hyperthyroidism have difficulty gaining weight. Now, most patients may experience some or many of the above symptoms because they can overlap. Now, before I explain what makes us different than any other doctor you've seen out there, I have a few things to explain to you so that you understand your thyroid condition. Let's talk about how the thyroid gland works. This is a very complex subject, and so in order for you to understand it, I have to you have to draw this out and allow you to be able to see that, okay? Because right now you probably don't know what's going on. So you're confused and you want answers, but no one will listen to you. I promise you that you'll know more about your thyroid gland by the end of this video than you ever had. Now, first of all, the thyroid gland runs our metabolism. It's like the gas pedal in the car, okay? Thyroid hormones virtually go to every cell in the body. They help regulate our metabolism. They help with fat and carbohydrate and protein metabolism. And this is very, very important. They also help with our mental growth and our physical growth. And it's also involved in regulating the heart. So the thyroid gland also promotes sleep, and it regulates cholesterol, and it can increase our heat and metabolism, and it has many, many more functions. So before I explain how the thyroid gland works from your brain down to every one of your cells, I want you to use this chart. I want to use this chart here to familiarize yourself with a few structures. First of all, let's talk a little bit about this chart here. Now if we take a look at this chart here, you're going to see that the word endocrine, that means any organ or gland in the body that actually secretes hormones that regulate the body. Now, first and foremost, up here in our brain, we have something called the pituitary gland. Right above that's the hypothalamus and the pituitary. Basically, these are our thermostats, or our master glands. The pituitary usually referred to the master gland, because this is like the air traffic control tower, and they help regulate hormones. Now, we can see that there's different systems that are involved here, and a lot of these systems intercommunicate with one another and work, either stimulate or inhibit one another. If we take a look here, you can see the stomach. Okay, we have the stomach that can play a role in thyroid health. Okay, if we take a look over here, we see the adrenal glands. The adrenal glands are your stress glands, and they sit right on top of your kidneys, and we're going to talk about how they have a role in working with the thyroid gland. In fact, in my book, I have a whole chapter on the adrenal gland. I said it's the most overlooked gland in conventional medicine because they rarely test for it, and if they do, they don't test it properly. I titled that chapter, The Adrenal Glands, Your Thyroid Gland's Best Friend. We also have to realize that hormone levels, if we look at people's hormones levels, that can have a role and have an impact on thyroid metabolism. So, this kind of gives you an overview of how the system works. Now, if you want to, the thyroid gland is located right here at the base of our neck, okay? And so what I want to do now is I want to draw out on this board here behind me how the thyroid gland actually works. So, in order for you to understand your thyroid condition, you're going to have to understand on how the thyroid works. So I'm going to draw this out on you on this board here. So please don't judge me on my art because I flunked art. First of all, up in our brain, as I just showed you, you have something called the hypothalamus, okay? And the hypothalamus, basically what it does is it sends a messenger down to the pituitary gland, and basically it tells the pituitary gland to release TSH. And TSH gets released, and what it does is it goes to the thyroid gland, and then it tells the thyroid gland to release T4 and to release T3. So let's back up. The hypothalamus sends down a hormone, the chemical messenger. A hormone's a chemical messenger. Made in one part of the body, goes to the other part of the body and tells it what to do. So it sends down TRH. You don't really need to know the names of all these hormones, but they send TRH down to pituitary. Pituitary then tells the TSH to go down and tell the thyroid to produce T4 and T3. Now, 93% comes out as T4 and 7% comes out as T3. Now, when they first come out of the thyroid gland, 99% of those are going to be bound to a protein molecule. So what happens is you have this big protein molecule. 99% are bound to that protein molecule. Now, these don't do any work at the cellular level, and I'll explain that in a minute. And so here's what happens. When T4 gets low in your body, T4 gets low, it sends a message up to your pituitary gland and up to the hypothalamus, and it basically tells them to send the message down and send TSH down to tell the thyroid gland to start making more hormones. Now, once the hormones come out, you have T4, 93%, and T3. Now, when these come out of your gland, first and foremost, what they need to do is they have to be transported to the liver. And so what happens is basically they have to get on the bus. We call this the TBG bus. It stands for thyroid binding globulin. It's a protein molecules that carry these things around the body. So when you get on the bus seats, a lot of them are going to have T4 on it because more T4 comes out than T3. So you're going to have a few T3s here. And then what happens is the TBG bus, is going to take it to the liver. Now, inside the liver, what happens is that T4, what happens is the T4 becomes and gets converted into free T3. Now, what happens here is that the protein molecule over here is no longer attached to that. So the free T3 basically looks like this if we call this the free T3 hot thyroid hormone. Okay? Now, T4 gets converted into free T3. Now, 60% of that free T3 virtually goes to every cell in our body. 20% is going to convert into something we call reverse T3. And this is the inactive form, so this doesn't do any work. It's inactive, okay? No work done there. So that really doesn't concern us today. And the other 20%, it converts into something called T3S or T3AC. And T3S and T3AC, they have to go through the gut, And inside the gut, there's an enzyme in there that converts it back to the active form of free T3. So this is inactive also until it gets converted back in the GI tract into the free T3, which is free, and then virtually can work at the cellular level. Now what happens is this, is that once it gets to the cell, we have a cell here, and on the cells we have something called receptor sites. Okay, and there's different shapes of receptor sites for specific hormones. So let's use the thyroid hormone. For example, that has to fit in here perfectly. Once it fits in there perfectly, it's going to send the signal into the cell, increase protein metabolism, carbohydrate metabolism, and fat metabolism, okay? And does a lot of other important aspects and actions. And once the signal gets sent in, then it's sent in. Now, you can see that if this thyroid hormone is bound to a protein molecule, that is not going to fit into the thyroid receptor site because this won't allow it. This is like a key and lock mechanism. It has to fit in here perfectly before the signal gets sent in. So, let's go through this a little bit slower now. First and foremost, when T4 gets low, it sends a message up to the hypothalamus, okay? And that's the first step. The hypothalamus then sends TRH down to the pituitary gland. The pituitary gland is going to tell the TSH, and what it does is it tells the TSH to stimulate something called TPO. And TPO, what TPO does is it tells iodine and tyrosine to get together and to hook up to make T4 and T3. Now, the numbers T4 and T3 come from that if there's 4 molecules of iodine hooked up to tyrosine, it's called T4. If there's 3 molecules of iodine hooked up to tyrosine, it's called T3. So that's where the numbers come from. Then what happens is T4 or T3 is released from the thyroid gland into the bloodstream. 99% of those are bound to a protein molecule. Once they're released in the bloodstream, they have to catch a ride and get to the liver. They take this bus, the TBG bus. And what happens in the liver, T4 is converted into free T3. Then the free T3, 60% of the free T3 that's available, virtually goes to every cell in your body. 20% is an inactive form. And then the other 20% converts into T3S or T3AC. This is inactive until it gets in the gut. And there's an enzyme in the gut known as intestinal sulfatase that converts it back to the active form of free T3. Once it gets to the cellular level, it has to fit into the receptor site perfectly, and it sends the signal into the cell. So what you can see here is that there's several different steps here. Okay, there's actually 10 metabolic steps. We'll number them in red to make it a little bit easier. Here's 3, 4, 5. We got the bus ride is 6. Okay, we got the conversion is 7. We got the gut, which is 8, and then it has to fit in the receptor site is 9. And once it's inside the cell, it has to go through a transcriptional response there to make it work. So you can see there are 10 steps, metabolic steps to the thyroid gland. Now, when they measure your TSH on a blood test, okay, they're really only measuring these 3 steps. So the other steps are not being looked at or accounted for, and this can create a problem. Okay, so doing the TSH test, guess what? They're only measuring these 3 steps. So what happened? The other steps are broken down. What do they tell you? They tell you that there's nothing wrong with your thyroid gland. Okay, so that's what happens. Now, let's talk a little bit about this because for most of you, 90% of you in fact, you don't really have a thyroid issue per se because 90% of people that have adult hypothyroidism, they have something called Hashimoto's disease. What the heck is that? Hashimoto's. Hashimoto's basically is an autoimmune disease. And Hashimoto's was discovered in 1912 by guess who? Dr. Hashimoto. Okay? And what happens is this is an autoimmune disease. So let's talk about an autoimmune disease. Let's say this is your thyroid gland, okay? And in an autoimmune disease, what happens is that the immune system, okay, and 60% up to 80, some people say, of the immune system is in your gut. And what happens is your immune system ramps up and it actually starts to destroy your thyroid tissue slowly over time. For some people it may happen faster. But what we have to realize is that there are certain triggers down here, certain factors that can stimulate the immune system to ramp up, get disorganized, overzealous, confused, and what it does is it goes up, it labels this, and then the immune system comes up and starts attacking it. Okay? So an autoimmune disease is when the immune system attacks healthy thyroid tissue. Now, your immune system was never designed to attack your own body or your own self-tissue. So something went awry in the body. Now, there's two parts to your immune system also. Number one is Th1, and we also have Th2. They should be in balance, okay? Basically, it's like a teeter-totter. If Th1 is high, Th2 is low. If Th2 is high, Th1 is going to be low. The vast majority of thyroid patients are out of balance. They're either Th2 dominant or Th1 dominant. So we need to get this back into balance, okay? Th1 is like the Pac-Man. He goes out and eats up and attacks the bad guy. Th2 is the guy walking around putting a name tag on the thyroid saying, yep, come and destroy this, come and destroy this, okay? So how do you know what you are? Well, actually, you can check this through a blood test or you can do a challenge test. And we'll talk a little bit about that in a little bit. So we have to realize that most people don't have healthy guts. And we see that a lot in thyroid patients, okay? And we have to realize they spend over $40 billion a year in hypochlorhydria, which is anti-acid sales each year. Now, we have to realize that HCl is for better flow through your lymphatic system. The lymphatic system is the garbage collection system of your body. It removes toxins and it creates these methyl groups, okay? And you have to realize that these things have to be in balance for it to work. Now, our body is constantly using DNA synthesis and constantly replicating cells. And so if you don't have these methyl groups available in order for your body to heal itself, then that's going to become an issue, okay? So first and foremost, let's talk a little bit about how we can look at what's going on and how hypothyroidism is treated in a conventional setting. Now, first and foremost, I'm not against medications. I'm not trying to take you away from your doctor. By law, I'm not able to prescribe or regulate medications, okay? That would be called practicing medicine without a license. We work with your doctors to help you achieve all your health goals. So first of all, you go to the doctor, they run a TSH, maybe a T4 test, and guess what? They give you a label. They say you have hypothyroidism. It doesn't matter your genetic makeup. It doesn't matter your color. It doesn't matter your ethnicity. They all throw you in the same bucket and they give you a diagnosis. Now, what do? What they're going to do, the medical approach, and this is no disregard to the medical professions, but basically a lot of times they put everybody on Synthroid or levothyroxine. And what happens? You take it and you don't feel any different. Even though you go back and get another blood test and they say it's normal, you still have all the symptoms of hypothyroidism. And a lot of times doctors will tell you it's all in your head, or you're nuts, or you're going to have to learn to live with it. Well, I'm here to tell you that it's not all in your head, okay? Some of them may tell you just get out and exercise. Change, you don't have any energy to do that. How can you do that? So we have to realize that 90% of Hashimoto's is an autoimmune disease. And medical doctors have no idea how to address the autoimmune component. Now they know one thing, and that's the thyroid medication. Now, if they're a medical doctor, they'll prescribe Synthroid or levothyroxine. Okay? If you go to a so-called alternative medical doctor, then what do? They might give you Armour Thyroid. Okay? But guess what, folks? That may be good for only one thing: primary hypothyroidism, when these three steps are broken down. Otherwise, the medications are not going to work for anything else that's dealing with your thyroid, any of those 7 other metabolic steps, or any of the autoimmune component, okay? Now, we have to realize that there's only a small percentage of patients and MDs that know how to address this, okay? A small percentage of doctors, I should say. So, what kind of results are you getting with this traditional model? Are you feeling better over time or worse? Probably worse if you're watching this video, because what's the definition of insanity? Keep giving the thyroid patients the same thing over and over and over again and expecting a different result. So if someone gets diagnosed with a thyroid condition tomorrow, goes to their doctor for conventional treatment, they're going to be put in that same bucket. And what happens? Same bucket as everyone else, same treatment as everyone else. So if you want to have a different outcome, the approach has to be different. So you can understand how we're different than any other doctor you've been to. Let me go into a little bit more detail on this endocrine chart. Okay? So I'm going to have you span over here, and we're going to take a look at this endocrine chart. Okay, as I said, the word endocrine, any organ or gland that secretes hormones that regulate the body. Now what we practice here is functional endocrinology. I'm not an endocrinologist. I don't pretend to be an endocrinologist. I will work with your endocrinologist, okay? But in functional endocrinology, what we do is we look to see how this system is functioning, and we balance the body systems out so that you're able to function at your optimal levels. So, what we need to do is take a look at a lot of these organs and glands and see how they intercommunicate and are involved with one another. Okay? Now, we talked a little bit earlier about the GI problem. As I said earlier, in order for T4 to be converted into free T3, you have to have a healthy gut. Because if your gut's not healthy, you're not going to be able to convert that inactive T3S, inactive T3AC, back into free T3. So a lot of times we see inflammation in people's guts. Okay? If you take a look, in conventional medicine, what I said in my thyroid book, the problem with conventional medicine that I see is that if you have a stomach problem, you go see a gastroenterologist. If you have a kidney problem, you go see a nephrologist. If you have a thyroid problem, you go see a thyroid doctor or endocrinologist. If you have hormonal problems, you see a urologist, or if you're a male, you go see, or if you're a female, then you would go see your OBGYN. But we have to realize that a lot of these things are interconnected, and no one is connecting the dots to see if some other system may be failing that could be affecting your thyroid. Okay? So, at one time in your life you felt better, right? So what happened? Something in your chemistry and physiology had to break down. So let's look at some of these glands and systems. First of all, the adrenal glands, the stress glands, they sit right here on top of your kidneys. Okay? Raise your hand if you don't have stress. Good. If anybody raised their hand at home, please email me, because I'm going to call you and I'm going to move in. Why? Because we all have stress. In my book, I stated the adrenal glands are the most overlooked glands in conventional medicine, because what happens is they don't test them properly. Now, if we can just scan back over here, let me just show you how the adrenal glands, they release cortisol. And cortisol should be high in the morning, and cortisol should be low at night. And it should have a nice gentle curve down like that. Okay, this is cortisol. Okay, this is our stress hormone. And what happens is that if you go to your doctor and ask him to test your adrenal glands, a lot of times they're going to say, what? Okay, we'll test it. And they do a blood test at 11 o'clock in the morning. This is 7 a.m., this is 4 p.m., and this one over here is 11 p.m. Okay? And so you go to your doctor at 11 a.m. and he says, oh, look at your blood test is normal. But what happened? Your 7 a.m. was here, your 4 p.m. was down here, was low, and your 11 p.m. was up here. This is how that graph would look. Okay? Does that look the same as the purple line graph? No. And this is our sleep-wake cycle. This is our circadian rhythm. And when this thing gets out of balance or is abnormal, this can maybe be one of the triggers or contributing factors of having difficulty staying asleep or falling asleep, because the rhythm is abnormal. It's our sleep-wake cycle. Sometimes this may be elevated in the evening hours. That could be an issue for you in regards to your sleep. So if the adrenal glands play a role in thyroid metabolism, I want to ask you a question. Have any one of your doctors tested your adrenal glands? Chances are they haven't. And if they have tested it, they probably didn't do it properly. To test it properly, you must measure the cortisol levels 4 times throughout the day. Okay? So they can't just go on and say, well, I checked it at 11 and everything's fine. Why? Because they'll miss the whole clinical picture. Okay? Many times some of you will go back to your doctor and say, I'm not sleeping well. What do? They want to put you on a sleeping pill, like the one with the butterfly. And speaking of that butterfly commercial, have you ever seen it? They explain the side effects of the medication, and it's crazy because some patients of mine have even told me and experienced this. Some of them get up in the middle of the night and they cook meals and they drive their cars around. They don't even remember doing it. A couple patients came in and told me, Dr. Unger, I got up in the middle of the next morning and my kitchen was a mess. There was food all over the counters. I know I didn't leave. I checked the doors. Nobody broke in, but I don't remember getting up and eating anything. I mean, that's pretty scary, but those are some of the side effects. Now, let's take a look at your GI tract. As I said, the GI tract has to convert T3S and T3AC back into the active hormone of T3. So you've got to have a healthy gut here to convert this T4 back into, the T3S or T3AC back into the active form of T3. So, if that plays a role in your thyroid metabolism, did any of doctors test to see if your gut had anything in there causing inflammation or an unhealthy environment? The answer is probably no, because most doctors will not run a test unless you're having some type of symptom. And believe me, a lot of patients have issues in their GI tract and don't have any gut symptoms at all. But when they're tested, we find a lot of different things that are going on in there that creates an unhealthy environment. And we'll talk a little bit more about that later. I also talked about hormones. Hormones play a role in thyroid metabolisms, okay? We have to realize that a lot of times estrogen can affect it, because estrogen can basically maybe take up some of the bus seats. Sometimes estrogen or xenohormones, which are things that mimic estrogen that come from the outside of the body, they're foreign to the body, they may block some of these receptor sites. So did any of your doctors check your hormone levels? Do you see what I mean by connecting the dots? So what we do differently here is we find out what broke down in your system and what are causing your thyroid symptoms, okay? Some people may have 2 causes, some can have 4, 6, 8, 10 or different triggers. We have to find them all. We will leave no stone unturned. So what is one of the reasons that make us different than any other doctors that you've been to? We do extensive testing to find out what are the mechanisms, the triggers, or causes of your thyroid condition. As I said earlier, if you want a different outcome, you have to have a different approach. So how are we different than any other doctor you've been to? We test both metabolically and neurologically, and we develop customized individual nutritional support programs, and neurological integration. Our metabolic treatments are based upon the results of the very specific testing we did on you, okay? We use individually tailored natural protocols to allow your body to achieve maximum healing. It has to be individually tailored because no 2 thyroid patients are alike. You can't keep doing the same thing over and over again and expect a different result. So this is how we're going to help you heal. Our goal is basically to look at your body. If you have toxins and things in there, if your immune system's ramped up, we need to calm that down, and we got to build it back up and balance out your chemistry. Like I said, everybody's program has to be individually tailored, okay? Because no 2 thyroid patients are alike. And there's a lot of thyroid gurus out there, and some are chiropractors, and they treat everybody the same way. Everybody walks in, take this supplement, take this iodine, take this, take that. Okay? Well, how do you know they need it? You don't know. In fact, one of the triggers, if we take a look over here, one of these triggers for autoimmune disease could be iodine. Okay? Another trigger could be estrogen. Okay? And another trigger may be food sensitivities. So all these different triggers, and when you take these things or have these things in your system, it ramps up and starts destroying your thyroid gland slowly over time. Okay? So our goal is whatever your goals are. We will help you find the most natural products to enhance your body so you have the best chance possible of living a long and happy life. Now this has to be all-encompassing to get the best results. So let's talk a little bit about the metabolic types of testing that we do. First of all, let's talk about blood tests. Now, before we talk about blood tests, let's talk a little bit about the lab reference ranges, okay? We have 2 types of ranges here, okay? And basically the ranges for the thyroid in most labs is 0.5 to 5.5, okay? Now, that's a pretty wide range. The functional range is 1.8 to 3.0, okay? So you can see this range is here, this one is much narrower, okay? So what we do is we try to get you into the functional or the optimal range. Basically, where do these lab reference range comes from? Well, they take everyone's TSH from a certain geographical region, and what do? They take all the blood tests for that year, they make a bell-shaped curve, they throw out some lows, some high, and then this bell-shaped curve is where they come out with their ranges. Now we have to realize that some labs are different, some labs prepare their solutions different, check their equipment different, and so on. So it's natural that different labs would get slightly different readings from the same blood sample. So if you go to lab A and get a number, and then your other doctor sends you to lab B, the numbers may be a little bit different. No big deal, but just understand that's the reason why. Now, each laboratory has a different lab reference range, okay? And when you're in this lab reference range, you're considered to be normal. As soon as you get outside, you get above 5.5, you get outside that lab reference range, then guess what? Then you're usually diagnosed with the disease or condition for which you're being tested. In this case, it would be your TSH. In this case, they would then say you have hypothyroidism. We use what we call the optimal range, 1.8 to 3.0. Okay, this range is much narrower than the lab reference range. Okay, you got 0.5 to 5.5 is way out here. Optimal range 1.8 to 3.0 is here. You can see it's much narrower. Now, if the test falls within this optimal range, guess what? Your body will be operating at a more functional or optimal level, okay? If you're outside of that optimal range, but you're still within the lab reference range, this means you're trending toward the condition or the disease state, even though you are considered normal in conventional medicine. Now let's talk a little bit about the blood test. We do extensive blood tests. Why? Because we have to look at the whole endocrine system at once, okay? I put together a comprehensive blood panel so we can look to see how that whole system is working. The most doctors will run on a thyroid patient, as I said earlier, is a TSH, maybe a T4. If you go see an endocrinologist, they may expand on those, but realistically, a lot of times the treatment doesn't change very much, okay? Occasionally, I might see a few more tests, but not a lot. Why? Because that's what the HMOs dictate and insurance companies dictate. They want to run the minimal amount of tests so they can give you a diagnosis, and then they can prescribe you a medication, okay? So we run about between 60 and 70 blood test markers so we can assess the whole body, okay? Don't worry, they're only going to stick you once. They're going to draw about 5 or 6 vials out, but you're not going to have to get stuck more than once, okay? So our specific blood panel is going to include a thyroid panel. We run at least 9 different tests on the thyroid so we can assess it properly. We also run a complete metabolic panel. We do a lipid panel where we're checking out your cholesterol, your good cholesterol, your bad cholesterol, your triglycerides. We do a CBC with an auto differential so we can do the subsets of the white blood cells and the red blood cells. We also look at your electrolytes. We also look at iron markers to see if you're anemic, especially if you're not having any energy. We also look at vitamin D levels because this is important for overall health. Vitamin D, and especially if you have the autoimmune component of thyroid problem. Vitamin D, very, very, very important. And another test that we run is we use nuclear magnetic resonant lipid panel. This is a fairly new test, but it's a better indicator whether or not you're going to have a cardiovascular event than the standard lipid panel that you're probably receiving from your doctor. If you want more information on this nuclear magnetic resonant lipid panel, you can find that on the website. Now, the next thing we do is we conduct food sensitivity testing. Why? Because a lot of people have food sensitivities and they don't even know it. So let's talk about the difference between a food sensitivity and a food allergy. A food allergy is when you eat a food and your tongue swells up, maybe your throat starts to shut down, you might get hives all over your body. That's an allergy. A food sensitivity is basically when you eat a food and it can cause inflammation, usually in your gut. And some of the most, and this inflammation can last for up to 6 months. So some of the most common food sensitivities, number 1, gluten. Okay, gluten is found in what? It's found in wheat, rye, and barley, and most oats. Even though oats aren't considered to be gluten, a lot of them are cross-contaminated because they're made in factories where gluten is, or where other wheat products or barley products or rye products are made. Okay. Other common sensitivities could be milk, soy, or eggs. And when you eat these foods, as I said, it causes inflammation. This would be, and this will produce inflammation. Now, some of these foods can be cross-reactive, meaning that you might go from gluten and then you start to go on amaranth or quinoa. And what happens? That the body, the immune system, thinks that amaranth and quinoa is gluten, and so it ramps up your immune system and causes that same inflammatory response in the body. Now, I know some of you might have went to a dietitian trying to lose weight, and they tell everybody the same thing pretty much, okay? Eat this much size of the meat in the palm of your hand, go from white bread to wheat bread, right? Count your calories, right? So, let me ask you a question. If you have a sensitivity to gluten and they didn't tell you that you did, or they didn't test you to see if you had a sensitivity to gluten, that could be a trigger that could ramp up your immune system and attack your thyroid gland on a regular basis. So, were you ever tested to see that the wheat bread was right for you? Probably not, because that one-size-fits-all approach doesn't work. Every time you eat bread, pastas, cakes, or cookies, even if they're made from wheat, that could be an inflammatory trigger and could ramp up your immune system, causing it to attack your thyroid. And remember, 80% of people who have hypothyroidism, the cause of it is an autoimmune response attacking your thyroid gland. Okay? Do you walk around some days with brain fog? You know, difficulty concentrating? Or is your short-term memory getting worse? The reason this may be is that you're eating foods that's causing inflammation in your GI tract, and that inflammation will also cause inflammation in your brain. So let's talk a little bit about some of the symptoms with food sensitivities, because a lot of these can overlap with other conditions, okay? You can have chronic pain or fatigue, sluggishness. We see a lot of times in kids, we see them, they get very hyperactive. Restlessness, maybe watery or itchy eyes. You might get blurred visions. You might get a stuffy or runny nose. Did you ever sit down for dinner and you eat and then you get mucus in your throat? Could be a food sensitivity. Some of you have poor memory and poor concentration or brain fog. And some people have it 3, 4, 5 times a week that they can't even focus. And very difficult. Some people have joint pain and it may move around. It might be in their elbows one day, their knees the next, somewhere else, the shoulder the next day. It's called migrating pain. Okay? Some people get mood swings, anxiety, fear, food cravings. Some people put on excessive weight. Some people have hair loss, burping, belching, all these things. Okay? Now, some people end up, when they eat some of these foods, they get bloated. And I know this from firsthand, because if I eat something that has gluten in it accidentally, and I'm sensitive to gluten, my belly blows up and it looks like I'm pregnant. Another symptoms a lot of people get when they eat certain foods is they get loose bowel movements. Did you ever eat something and then 20 minutes later you're in the restroom with a loose stool? This could be a food sensitivity. This is your body's way of getting rid of the culprit or the perceived toxin. Further symptoms, you could have constipation, or maybe you're getting constipation, loose stools, constipation, so they can alternate back and forth. And occasionally somebody may have a food sensitivity and actually vomit. So some of you may not feel any of these symptoms to these food sensitivities at all, but it does cause low-grade inflammation in your gut. That low-grade inflammation can ramp up your immune system to attack an autoimmune thyroid. So the only way to find out if you're suffering from any type of these sensitivities is to run the test. The benefit of the test is that we can determine if any foods you're eating are causing or promoting inflammation, and therefore is a factor in the autoimmune response in your thyroid metabolism. Now, as I said, the adrenal glands play a role, and I said I wrote a whole chapter on that in my book. The adrenal glands, what happens is right here, cortisol. If you have too much stress in your body, cortisol will inhibit this conversion of T4 into free T3. Okay, you got to have enough zinc. You got to have enough selenium. If you have enough zinc and selenium, that's also, these are cofactors for this T4 to be converted into free T3. Okay, so how do we test for this? We basically do a saliva test. It's much like DNA testing. Okay, and basically we have stressors in our body. Tissue damage can increase cortisol. Inflammation, pain in our body. Blood sugars going up and down, or blood sugar dysregulation can cause an increase in cortisol. Okay? GI problems can cause an increase. Inflammation in the gut can cause that. So when your body's cortisol levels are out of whack, it can affect this conversion of T4 to free T3. And it also has been shown that when cortisol is elevated above the normal levels, the physiological levels, it can affect the area of the brain called the hippocampus. This is where your short-term memory goes to long-term memory. And this excess cortisol is toxic to the neurons in your brain, and they actually lead to the neuronal death. In other words, your brain cells die. This can affect your memory. Let me ask you this. How's your short-term memory been? Is it getting better? Worse? Not as good? Why? Don't fall for the old saying you're just getting old, because I think that's wrong. Okay? This may be a part of it. If you've had stress or had stress in the past, you must do an adrenal stress index test. Okay? Because we have to evaluate that. Now let me talk about the adrenal stress index test. First and foremost, a lot of doctors will run an adrenal stress index test. And then what they'll do is they'll just throw you on a bunch of adrenal support. And you say, take this is for adrenal support. The question becomes, why did your adrenal glands become imbalanced or fatigued in the first place? Was it due to inflammation in your gut? Was it due to blood sugar levels going up and down? Was it due to a parasite you have? Was it due to some bacterial infection that you had in your body? So not only do we run the test to see if it's in balance, the next thing we need to add is to ask the question, why? Because just to throw you on a bunch of adrenal supplements like I see a lot of chiropractors out there doing, a lot of nutritionists doing, guess what? How long are you going to have to be on those vitamins? The rest of your life? Because they didn't fix the underlying cause or trigger of the problem? Food for thought. Now we also look at immune panels. Okay? A lot of times we have to see that autoimmune is when the immune system gets disorganized, confused, and what happens, it starts attacking your body's own tissue. Okay, now your body, as I said earlier, was never designed to attack your body's own tissues. Wasn't designed to do that. Let's talk about different autoimmune diseases, because I know some of you are familiar with other ones. Did you ever hear of rheumatoid arthritis? That's when your immune system attacks your joint. If your immune system attacks your nervous system in your brain, they call that multiple sclerosis. If it attacks your connective tissue, it's called scleroderma. If it attacks your thyroid gland, as I said, it's Hashimoto's thyroiditis. We have Sjogren's syndrome, irritable bowel, lupus. These are other autoimmune disorders. Also psoriasis. That's an autoimmune condition that involves the skin. Now this is where my personal story comes in. I had psoriasis and it covered about 90% of my body. I did the shots, I did the creams every day, all these cream shots, did everything. It just kept spreading and spreading. Pretty soon, it was so embarrassing. I'd go to a summer party, I had long shirts on, long pants on. Everybody would be looking at me, hey, you want to go swimming? I'm like, no way, because my skin looked like I almost had leopard. It was just a thick, scaly white thing all over my body. So I went to, and I asked my dermatologist, I said, we need to get a little bit more aggressive on this. And she said she could give me a medication, but the side effect that if I caught a common cold, that I could die, because the medications would suppress my immune system so bad that it would not be able to ward off this common cold infection. I said no thank you, and that's what started me on my journey to fix myself from the inside out and to help others like you. And I've seen incredible results over the years, and I'm so thankful that I did have this condition. Now, the benefit of some of these immune panels is so that we can see what's going on. Because if you have an autoimmune disease, this must be addressed first. We have to calm down the autoimmune disease. Let's talk a little bit about how this autoimmune disease can be triggered in the first place. Now, if we take a look here, first of all, we say estrogen is a trigger. So when's the first time ladies have an increase in estrogen? When you first start cycling. So we see young teenagers, when they first start cycling, they were doing really good in school, getting A's, getting all good grades, no problems with behavior and things like that. And then what happens is their grades start to go down. And they started their cycle, and what happens, when the estrogen went up in their cycle, that could have been a trigger to turn the gene on to tell the immune system to start attacking the thyroid. That could be a possibility. Okay? Now, we have to realize the next time estrogen goes up in our system is when? Estrogen goes up during menopause, because you're going to have surges of estrogen. Because sometimes they go up in menopause, they're trying to bring them down, then you'll get a surge of estrogen. And that surge at that point in time can actually trigger an autoimmune response. So we have to realize that we have to figure these things out. What triggers these autoimmune response? Once the gene is turned on, you can't turn the gene off. All we can do is modulate the immune system. Is TH1 too high or TH2? Modulate the immune system to calm it down, so it doesn't keep ramping up and attacking and destroying your thyroid gland. Okay? Because that's what happens. So that's why it's important to test. And did you know this? 50% of people with one autoimmune condition have more than one autoimmune condition. This is called polyautoimmune. There's a test that can determine if you have antibodies to other tissues, and it'll show up, the antibodies will show up years before you actually see the symptoms, or years before it actually starts destroying the tissue where it becomes evident. How important is that? That's pretty important. So if you have an autoimmune disease, you must address the immune response and not the thyroid gland. And that's what they're doing in conventional medicine. And that's why you may still have all your symptoms, even though your blood work is normal. Now let me tell you one thing about autoimmune diseases and conditions. You have to realize this. First and foremost, if you have one autoimmune, and I'm going to give you a case study that recently happened in my office. I had a young girl several years back, 2-3 years ago, came into my office. She had Hashimoto's, her dad had Hashimoto's, her mother had Hashimoto's. And so what happened is I told them that they needed to get gluten out of your diet because they were sensitive to gluten. And I told them the other things they needed to do to keep the immune system calmed down, because I told them that if they keep this up, the immune system could get even more disorganized and confused, and it could go and attack other tissues. Well, what happened in this girl's particular case is, guess what? They called me 3 years later. The father stayed off gluten, the other family members didn't, and guess what? her daughter ended up getting diabetes, okay? And it could be type 1 diabetes because the immune system then started attacking the beta cells of the pancreas. This is why you need to take this seriously. There are studies that show that if you go off gluten for a while and you go back on them, you are like 20-30% more likely to get another autoimmune disease. This is how important this is. This can have saved you from maybe going down the road and getting rheumatoid arthritis or multiple sclerosis or scleroderma or Sjogren's syndrome. Think about this. Let's talk a little bit about other testing we do. First of all, we have to test what? Your GI tract, because 60 to 80% of the immune system is in the gut. Okay, don't worry, you perform the stool sample in the comfort of your home. Okay, but this is where we find most people's sources of inflammation. It's in the gut or GI tract. Now, 60% of your immune system, or 80%, is in the gut. So you got to have a healthy gut if you want to have a healthy immune system, right? So, and a lot of times, as I said earlier, you might not have any symptoms whatsoever. But a lot of people are going to have fungal, yeast, or maybe H. pylori, maybe low-grade C. diff without any symptoms. Some people have tapeworm, roundworm, trichinella, bacteria overgrowth, amoeba histolytica, And I know we live in the United States. And I know most people think that we don't get these things. But guess what? Rarely do we see a negative GI panel. Okay? As part of our GI test, we check for something called H. pylori. That's a bacteria that's found in a lot of people's GI tract. And if it's found outside its normal range, in other words, if it has overgrown, it can cause inflammation. And the H. pylori has been shown to cause stomach ulcers, and it's also been shown to cause stomach cancer, also known as gastric carcinoma. Sometimes these little critters, these H. pylori critters, can be very, very stubborn to get rid of. And even the antibiotic medications that your medical doctor puts you on may not get rid of them. And it's important to do these follow-up tests, okay, to make sure the H. pylori has been eradicated. I can't tell you how many times patients come to me and they tell me, well, my doctor said I had H. pylori, he put me on an antibiotic, and then I ask them, did he ever retest it? And they say, no. You have to retest to see if it's gone. Because if it's not gone, it's still creating inflammation. Other testing we look at for the GI tract is we look at intestinal permeability testing, okay? So we're looking to see whether or not inside your gut, basically, you have this hollow tube. And in this hollow tube, you have like a piece of saran wrap. It's a mucosal barrier. It's called secretory IgA. And we have to look to see if that's been altered or damaged. Okay, and when it does get damaged, what happens is that this barrier has tight junctions. And what happens is that these junctions start to separate apart in large undigested molecules, proteins, toxins, microbes. They leach back in, out into the bloodstream again. These things are supposed to go out your rectum. And what they do is they get back in the bloodstream, and what do? They ramp up your immune system because they cause inflammation. And then the inflammatory response they cause, that causes an increased response on that piece of saran wrap, and it starts to break it down even farther. So you end up in this vicious cycle. And no one's looking at that and trying to fix that and remove the culprits. So we have to look at these things because anything that causes the immune system to ramp up can affect your thyroid gland if you have the autoimmune component. And like I said, 90% of people, okay? And most doctors don't even address these issues. So now do you see how we're different than any other doctor you've been to? Let's talk a little bit about hormonal testing. How do we test about hormonal testing? First of all, we check both male and female hormones, and it doesn't matter what sex you are, in both females and males. Why? Because when women get older, guess what? Women, you start to get more testosterone. Even though testosterone is a male hormone, you start to get more of it because your chemistry and metabolism has started to shift. So now you produce more testosterone. This increase in testosterone can cause insulin resistance. The more insulin resistance they have, the more testosterone you make. The more testosterone, the more insulin resistance. Okay? And did you know that this high testosterone could be related to the thinning of your hair on the top of your head? And high testosterone has also been shown to increase facial hair. And if you have insulin resistance, it makes it very difficult for you to lose weight. So you might be caught up in this vicious cycle, and that has to be broken. Now for females, when you go into menopause, what happens is this, is that your estrogen in relationship to progesterone may not be in the right ratio. So estrogen is a gas and progesterone is a brake. So they have to be in balance with one another. And guess what? When you go into menopause, guess what takes over for making your progesterone? Your adrenal glands. And those are your stress glands. And if you're all stressed out and your stress glands are trying to regulate your blood sugars, fight inflammation in your gut, fight tissue damage, fight pain, they don't have any energy left to make progesterone. And that's why some women go into menopause and have no symptoms at all, and other women go in there and get where they have hot flashes, night sweats, you name it, okay? Because your adrenal glands didn't have enough energy to pump out more estrogen, okay? They become fatigued. If you keep pumping the well and it doesn't rain, what happens? The well's going to dry up. If you keep pumping the adrenal glands and they can't rest and you don't have the nutrition to bring them back to get them healthy again, what happens? It's going to throw off your chemistry. Now, a lot of times we see women in menopause, most of them are estrogen dominant. And here's what you have to handle about estrogen. Now, their estrogen could be normal, progesterone down here, they're still estrogen dominant. Or the progesterone could be normal and their estrogen up here, they're still estrogen dominant. And guess what estrogen does? Estrogen makes more fat cells. The more fat cells you have in your belly, the more estrogen you make. The more estrogen you have, the more fat cells. And you end up in that vicious cycle. So there's another vicious cycle that has to be fixed. And then you wonder why you can't lose weight. Some of you exercise 3-4 times a week. You walk by a salad bar, don't even stop. You gain 4 pounds. Some of you may lose 5 or 10 pounds. You plateau off. You can't get it down any further. And it comes right back. Pretty frustrating, isn't it? The reason is because you may have a hormonal imbalance, and this can be one of the triggers for you not to be able to lose more weight, and it could be one of the triggers for your autoimmune response. And that's why you may still suffer from all your thyroid symptoms. Now men, guess what? When we get older, we start to get more estrogen. Why? Because there's a change and shift in our metabolism. Okay? And guess what? There's a lot of men out there with man boobs, so to speak, okay? So what happens with your physiology and chemistry changes, and it causes your body to start making more estrogen, and you're no longer testosterone dominant. And estrogen in men can cause more insulin resistance. More insulin resistance, more estrogen. That's why when men start to lose the dominance of testosterone, which keeps our muscles lean and things like that, that's why when they lose that testosterone and start making more estrogen, that's when we start to see what? They start to get the belly. Okay? What else can we see that when estrogen becomes more dominant in men? Their prostate gland may enlarge. You may have been diagnosed with benign prostatic hypertrophy. Okay? Or you're heading down the road maybe to prostate cancer. Food for thought. So men, when you go into andropause, which is similar to menopause in women, and basically andropause is when you're no longer testosterone dominant. You have to realize, men, that testosterone falls 2 to 4% each year after the age 40. So it's a nice gentle slope going downhill, and what do you refer it to? Getting old. Some of the symptoms that are related to abnormal hormone levels be depression, mental fatigue, you can have fogginess, mood swings, hot flashes, weight gain, the thinning of the hair, your libido is no longer there, you no longer have the physical stamina. So we have to look at these things. So what we do is when we test hormones is we do it through a saliva test. And what we do is we measure that free fraction hormone. Remember we talked about hormones earlier? We said the ones attached to a protein molecule. This is the bound one. Okay, they call this the bound protein molecule. And a lot of times when they run blood tests, they check the protein bound ones. They don't do any work at the receptor site. Okay? Remember, this had to fit into the receptor site to send the signal in. So these bound ones really don't do any work here. Now they can run these ones on a blood test, but because they're so expensive, they don't want to. Why? Because the insurance companies are trying to keep their costs down. Okay? So the free fraction hormones, what we do is we test them in a saliva test. It's just kind of like a DNA test. And then we can measure the free fraction hormone. And I know some of you ladies are out there and you're on these hormone replacement therapies and things like that. I'm going to tell you, when you test the free fraction hormones, you're going to see a vast different than what your blood tests are showing if they're not measuring your free fraction hormones. Let's talk a little bit about neurotransmitters, because sometimes we may have to test patients to see what their neurotransmitter levels are, how their neurotransmitters are functioning. Okay? Now remember, neurotransmitters, these are happy hormones, right? Dopamine, serotonin, GABA, and a lot of you may be losing, pleasure and interest, things you used to do. You're losing pleasure in that. You no longer enjoy your friendships and relationships as much. You might isolate yourself from others. You're not as social. You don't go to family functions like you used to. You might feel anxious. So a lot of things can be affecting those neurotransmitters, okay? So we have to look at these things and see if they are in balance, okay? So we have to assess these because these are needed. One thing that people don't know is up here in your hypothalamus, dopamine and serotonin is very important. Dopamine and serotonin are needed to stimulate this or wake up the hypothalamus to tell TRH to go down and tell the pituitary to release TSH. So that can be an issue there. Is anybody looking at this? Probably not. And then we also test for inflammation. Why? Because inflammation is the #1 cause or culprit for chronic degenerative diseases. So in our blood tests, we look for homocysteine levels, we look at uric acid levels, we look at fibrinogen levels, C-reactive protein, ferritin levels, all these different levels. Because many patients suffering from chronic health conditions suffer from inflammatory process. We have to find out what the triggers are for the inflammation. And just about every autoimmune patient that I've treated suffers from some form of chronic inflammatory process. And guess what? It's not usually addressed in conventional medicine. So that wraps up the different types of metabolic testing we use. Let's talk a little bit about neurological testing, okay? Basically, our neurological therapies are based upon specific neurological testing and the results of the neurological testing that we do. Now, these are some tests we may run in an exam room and find out if the brain is firing right. Is the brain working right? Okay? So we use very specific brain-based therapies, such as vibration therapy. When you put vibration into a person's body, it's going to stimulate the cerebellum back here. And the cerebellum has a lot of control over a lot of different functions in the body. We may use auditory or visual or olfactory or caloric stimulation to increase the firing of the brain. If we have you take something and smell it up your nostril like peppermint on the one side, that's going to fire your brain there. Maybe your brain's not firing. We have to get the brain working again. We have to exercise it. The brain controls everything. We have to get it functioning better. And there's other type of additional things we may use. And we don't use everything on every patient because everyone's an individual. So we might use castor oil packs to help with detoxifying the liver. It's something you can do in the comfort of your home. And guess what? There's no side effects to that. Now, if I stood up here and I told you that you should all take this vitamin or that vitamin, or you should all go on tyrosine, or you all should take iodine, or you all should take this thyroid support pill, then you should get up and shut the DVD off. Or if you're sitting at your computer, turn it off. Why? Because that's the same approach as the drug model therapy. And you already know how that's working. You just can't take a supplement or vitamin for every symptom you have to get to the underlying cause or causes of your problem. Now let's go back here. As I said, we talked about these 3 steps right here. Remember? TSH goes down and tells TPO to tell iodine and tyrosine to hook up to make T4 and T3. Okay? Now, you go to some doctors, they want to put you on iodine. If they're going to do that, you better make sure you don't have an autoimmune disease first, because that could be a trigger for it. Now, there's 2 camps out there on iodine. One says iodine's great, the other camp says it's not. Well, I'm kind of hanging with the camp that says it's not until I rule out autoimmune disease. But we have to test everybody and find out. And if you put somebody on iodine, you better have a test that you can test them before and a test that you can test them after to see if it is increasing the autoimmune response. Because if it is, it's not right for you. Okay? Now, there is no study out there that shows that giving somebody tyrosine, okay, will increase their T4 and T3 in their body. Not one test. So if you're going to somebody and you're just throwing you on these things because iodine and tyrosine make T4 and T3, if you're going there doing that, guess what? I don't think they have a full understanding of the physiology and chemistry. And that's my personal opinion. Now, I know most of you have done some research on the internet. Some of you read maybe one or many thyroid books and followed the advice in them. And what happened? Nothing. Some of you got online, ordered iodine, tried it. What happened? For most of you, not much. For some of you, you got worse because you didn't get to the underlying cause or the triggers. So you didn't know what to remove or what was missing in the first place to bring the body back into balance so it can function the way it was designed to function. The body has the capability of healing itself if it is in balance and it has the nutrients and cofactors that are needed. So that's why metabolic testing is so important. So one of the most common questions I get is this: Dr. Unger, why doesn't my doctor test my thyroid completely, including the thyroid antibodies? Because I didn't talk about those, and I want to talk about those right now. Remember we talked about Hashimoto's? Well, in Hashimoto's, how do you know if you have it? There's an antibody test. It's called TPO, or thyroid globulin antibodies, okay? And if this is a simple blood test, if either one of these come back, that means you have an autoimmune component. Now sometimes in Graves' disease, you could have a thyroid stimulating hormone or thyroid stimulating immunoglobulin antibodies. And this is usually equated with Graves' disease. A lot of times these two overlap, and sometimes Graves can go down into Hashimoto's. Okay? That's what the research is dictating out there, folks. So a lot of times the doctors won't run these antibody tests. Okay? They just don't do it. So, and let me explain why they don't run these tests. You know, because you wonder why don't they run them. Now, if you complain enough, they might. Or if you go to an endocrinologist, I'll give them credit, they'll run the test. But here's the thing. The reason is that they're not going to change your treatment plan. In other words, they run the test and you're positive, they're still going to treat you the same way regardless of your symptoms. Let me give you an example. I did a Google search for Hashimoto's thyroiditis, and Mayo Clinic came up first. And here's what it said. It said, the doctors will test your thyroid function to help detect Hashimoto's disease. Okay? And doctors, the treatment of Hashimoto's with thyroid hormone replacement is usually simple and effective. Well, I have to respectfully disagree. It's not effective for a lot of patients. If it was, you wouldn't be watching this video. And it goes on to say that the disease typically progresses slowly over a number of years, and then continually starts to chronically break down the thyroid gland. And that's going to lead to a drop in your thyroid hormones because you can't make them anymore, and then you have to be on replacement therapies. The doctors have to look at the immune system to balance that out. Now, some of these guys think it's a virus or bacterium that trigger the immune response. Okay, really, you have to realize that if you don't get treatment, without treatment, this is going to become more damaged. And what happens sometimes in here, you have your little cells. Remember, you have these cells in there that make T4 and T3. A lot of times some of these cells will become enlarged because it's getting destroyed. They enlarge. And what do they call this? They call this a goiter now. Now you have a goiter. So we have to look at the underlying causes. What are the triggers for it? Okay? Now, I have a medical doctor's wife in my program, and he came in and I asked if he tested her for these antibodies. He said yes, and I asked him, do you test all your patients? He said no, and I said, why not? He said, because it doesn't matter. It's not going to change the way I treat them. So as you can see, whether it's the Mayo Clinic or the family physicians, they were taught to treat patients this way. Nothing against them. They're doing everything in their possible way that they can think of to help these patients. But you have to realize that these doctors went to school to really help people, but when they're in school, there's certain protocols and certain treatment programs they're instructed to follow. And guess what? You know, on them protocols and treatment programs are written by doctors. And 75% of doctors who are writing those treatment protocols and prescription programs, 75% of them are on the drug company's payroll. So what are they pushing? They're pushing medications. And sometimes they're skeptical doctors like me. Oh well, our results speak for themselves. Now, I need to know, you have to realize, some of you people out there may have to stay on your thyroid medication. If you have primary hypothyroidism, you are going to need the TSH. Okay, you are going to need the TSH. Okay, you will need that medication. But if these other 7 steps are broken down, or if you have an autoimmune component, there's things that we can do that's probably not being addressed by your doctor. So if every person watching this video is different, and every person in this video we do tests on, and all their test results are different, what should the approach be to get the patient's health back? Different, right? What a concept. This is not rocket science, folks, okay? Our customized, individualized metabolic programs, including nutritional supplements, herbs, vitamins, some creams and gels, dietary and healthy lifestyle changes, is based upon the results of your very specific testing. Each plan is going to be customized and individualized based upon your metabolic and neurological testing, so we can bring your body back into balance and your chemistry back into balance so it can function the way it was designed to function. So when we talk about functional endocrinology, what are we really talking about? We're talking about restoring function to the endocrine system, all them glands and organs. And we have to realize that if there's any changes or alterations in the function, in the metabolism, there's ways that we can apply certain types of conservative therapies such as diet, nutrition, and healthy lifestyle changes, instead of trying to put drugs on you that dominate or over-dominate physiology or dominate over physiology to manage these symptoms. So we do have different types of programs, we have different lengths of programs, we have different tiers to these programs, which we'll discuss with you one-on-one when you come in and schedule a visit with one of our doctors. Now you can bring your insurance information, we'll discuss your insurance information with you. Now some people's insurance coverage is going to be limited. I rarely have patients worry about that aspect though, because they will do anything to get their life back, or to get the most common thing I hear, I want to be my old self again. Okay? Now remember, your insurance only covers the basics. If you're the type of person that thinks insurance should cover everything, probably not going to be a good fit here in our office. There is out-of-pocket expense. I'm going to be right up front with you. So one thing I want to talk about is that only you can make the decision to change. You come to the grip with the fact that what you're doing isn't working. And the best predictor of the future is your past. And what you've been doing in the past hasn't worked. So let me ask you this question. Where are you going to be in another 3 years? Another 5 or 10 years? Where do you see your health being in the next few years? If you're sick and tired of being sick and tired and you're ready to move forward and add value to your life, I want you to ask yourself a few of these questions. Number one, how has your thyroid condition affected your relationships, your finances, your family, other social activities, maybe not going to watch your kids or grandkids play baseball because you just don't feel up to it, okay? Sports activities, you're not feeling well, okay? What does that cost you in time and money and happiness, or sleep for that matter? Okay, if this problem isn't taken care of soon, where are you going to be in the next 1 to 5 years? What is it worth to you to improve your condition? Okay, and the reason I ask that is that some people are not serious about changing their lifestyle. If you think you're going to be able to come here and eat the same foods you're eating, don't waste my time, please. Because when your test results come back, there are going to be certain foods you have to keep out of your diet, and that is for a lifetime. Because when you eat them, it can create inflammation in the body for up to 6 months. The other thing is I want to know where you are on a scale of 1 to 10. How motivated are you? How committed are you? If you're not between 8 and 10, you're probably not going to be a good fit here. Okay? Because the people that are below 7 or below, guess what? They don't want to get off gluten. They don't want to stop drinking coffee if they have to. They don't want to stop dairy. Now we all try to give alternatives to these things if they're out there. Okay? When I first had learned about gluten sensitivity and things, there was nothing in the health food stores. 15, 20 years ago, patients didn't know what to change to. Now, if you go to a health food store, there's over 600 gluten-free products. You have gluten-free pasta, you got gluten-free bread. That wasn't around back then. A lot of patients were upset with me when I told them they couldn't have it. So now, if you're a 7 or below and you don't want to make those changes, please, don't call the office. If you're at an 8 or 10 on your motivational level, please call my office, okay? But this is only part of the decision-making process. You got to figure out why. Why do you want to be a better human being? Why do you want your life back? And if your why is big enough, then the how really doesn't matter, how you're going to do it. Most patients know their why. They want to be alive and healthy for their families, their grandkids. They want to see them graduate. Some want to see them get married and basically get their life back. So finally, if you made this decision and you know you want to change, you must be willing to take part of the necessary steps. Okay? So if you like what you heard today, and like what I told you today makes sense, that we treat the whole system and the person, not the condition. If you made the decision to change things now, know that you want to do it, and know that you're willing to do whatever it takes to make that change. Like I said, we'll offer you a one-on-one consult to sit down with one of our doctors for 45 minutes to an hour. Now I can give you all this information today, you can have all this knowledge today, you can get a little bit excited today, but if you don't take action and move forward, it's all for nothing. All for nothing. So remember, this appointment is for you, it's for your family, it's for your loved one, it's for your grandchildren, okay? Now, at your one-on-one consultation, we're going to sit down, we're going to go through a very thorough case history with you, probably ask you more questions than any other doctor has, and determine if you're a good fit here. We don't accept everybody into our programs. We screen people very rigidly, and if they're not ready to make the necessary changes that are necessary, then we won't allow them into our program because we're just setting them up for another failure. Doesn't mean you're a bad person, just means you're not ready for the program at this point in time. Now we also do telephone consults for people who live out of town. Many people fly into Cleveland or Akron-Canton Airport. We are here to get you better because I know most of you have been everywhere else and you have nowhere else to go. A lot of people come into me as their last hope. I hear that all the time. If you want to come in for a consult one-on-one, there's a couple requirements. Number one, health has to be your top priority. It must be number one on the top rung of the ladder. What do I mean by that? I mean that if you're taking care of a parent, a grandparent, a grandbaby, or something like that, and they're a higher priority than your health, then you're probably not going to be a good fit here. Don't come in and schedule a one-on-one appointment. You have to be number one. You have to be ready to go. If you're not ready to go, I'm moving on to the next patient who is ready to go. Okay? Isn't it about time you took care of yourself for a change? Second requirement, you must bring your significant other when you come back for a second visit. Why? Because they're either going to support you or sabotage you. Okay? You have to realize that if the husband's going to be bickering at you or their wife's going to be bickering at you day in and day out and stressing you out, guess what? It's not going to allow the system to work properly. Okay, give you an example. We had a gentleman and his wife come in. I told his wife some of the things she had to change, and she said, yeah, I can do that. And he looked at her and said, what do you mean? You haven't done that for the last 20 years. What makes you think you're going to do it now? Is that supportive? All that stress she's getting at home ain't going to help her body heal properly. And she would probably never get better. Unfortunately, I couldn't accept her into the program. Now, if you're not married, if you're single, if you're widowed or divorced, you don't have to go get married and come in. Okay? Why? Because that's too much stress, right? So you don't need to do that. However, if you are married, engaged, or live with a significant other, you must bring them with you. If you're elderly, late 70s, early 80s, we have patients in our programs that are elderly, please feel free to bring a family member if you're widowed or single. Okay? Now, if you're the type of person that wears thyroid on your collar and you walk around, I got a thyroid problem, I have to live with it, or you're the type of person that jumps from doctor to doctor to doctor and doesn't let anything work for any amount of time, probably not going to be a good fit here. You don't have the right attitude. Okay? Now, if you're the type of person that says, I'm sick of this, I tried everything, I want to get my life back, I want to get my health back, I want to be my old self again, I'm going to take charge of my health, then you'll probably be a good fit here. And again, as I said, if you think your insurance is going to pay everything, you're wrong, okay? We all know that insurance companies don't pay for vitamins or supplements. So again, if you're in the mindset that insurance should pay for everything, probably not going to be a good fit for our program, okay? And we also want you to be on time. We run a tight ship here, and rarely we run late. Our time and your time are both valuable, okay? So remember, we're scheduling a full hour for you. So please, if you're not able to make it, please let us know as soon as possible so that we can use that time to help somebody else who wants to be helped. We all know that certain things come up, you may not be able to make it, but please give us a call and follow our appointment confirmation procedures, okay? And the last thing, if you receive any paperwork from us, when you come back in, make sure that it's all filled out before you come back in, okay? I don't want my staff coming back saying they're out in the waiting room finishing up their paperwork. It must be done before you come in. If you don't know the answer to it, put NA for not applicable, okay? Now, if you don't fill the paperwork out properly, what's that going to say to me? Well, I asked them to do this first thing and they didn't do it. What are they going to do when I ask them to do step 2, 3, 4, 5, and 6? Okay? So, now I take this stuff very seriously. And I'm not trying to be mean or anything like that, but the more I know about you, the better I can connect the dots and help you get your life back to see what broke down in your chemistry and physiology. And the last thing, we'll ask you to sign a piece of paper indicating that you or your significant other have both watched this video prior to coming back for your appointment or your telephone consult. So if you're watching this on the internet, please make sure your significant other watches it before you come in for your appointment. Now, if you have any questions, you can email me at drkunger@feohio.com. That's drkunger@feohio.com. So if your why is big enough, you'll probably make the decision, and you want to make the decision to improve your life, you'll be committed to being the best version of yourself you can be. So take action. Come in and see us. I look forward to being part of your success. We'll see you soon.